Don't miss these 10 skin red flags for diabetes. Diabetes is a medical condition that occurs when the body has trouble regulating blood sugar levels. There are two main types, type 1 and type 2 diabetes. In both cases, the body's ability to use or produce insulin, a hormone responsible for regulating blood sugar, is compromised. As a result, blood sugar levels can become too high, leading to various health complications. Now, let's talk about the consequences of diabetes. If left untreated or poorly managed, diabetes can wreak havoc on your health. It can damage various organs and systems in your body, including your eyes, kidneys, nerves, and yes, even your skin. Before we dive into the 10 skin red flags for diabetes, let's discuss some of the potential risks associated with this condition. Uncontrolled diabetes can lead to heart disease, stroke, neuropathy, and vision problems, among other issues. It's crucial to catch these warning signs early to prevent severe complications. So, why is it so important to recognize these skin red flags for diabetes? Well, these signs can serve as early indicators of the disease, giving you a chance to seek proper medical attention and make lifestyle changes to manage it effectively. Now, let's break down each of these skin red flags and understand how they relate to diabetes. These signs are not just cosmetic issues, they're indicative of the underlying health problems caused by high blood sugar levels. The first indicator to watch out for is the presence of dark skin patches. You may observe areas of skin with a darker, leathery texture, typically located in the creases and folds of your body, such as the armpits, the back of the neck, or the groin. This occurrence is closely tied to elevated levels of sugar and insulin in your bloodstream. Essentially, these excess sugars trigger an accelerated production of skin cells, resulting in an increased concentration of melanin pigment within these cells. This heightened melanin content leads to a visibly darker appearance compared to the surrounding skin, often accompanied by a velvety, dry texture. Additionally, some individuals may notice the development of numerous small growths, or skin tags within these patches. Moving on to the second sign, fungal toenails. Individuals with elevated blood sugar levels or prediabetes are susceptible to fungal infections of the toenails. This condition manifests as thickened, discolored, and yellowed toenails. Furthermore, they may frequently experience athlete's foot infections, characterized by cracked and intensely itchy skin around the toes and soles of the feet. It's essential to understand that fungus thrives on sugar, making higher blood sugar levels a conducive environment for fungal growth. Moreover, diabetes and prediabetes compromise the immune system, rendering the skin more susceptible to fungal infections. This fungal issue can extend beyond the feet, leading to problems like jock itch around the genitals, yeast infections, and ringworm. In summary, these skin-related signs can offer valuable insights into your metabolic health, particularly regarding blood sugar and insulin levels. Monitoring these indicators and taking appropriate steps for management and prevention is crucial for your overall well-being. The third symptom involves sensations in your feet. Although not visible, you may experience various sensations such as tingling, burning, itching, irritation, stabbing pains, or even electric-like shooting pains in your feet or toes. This phenomenon arises from the damaging effects of high blood sugar levels, or excess insulin on the nerves in your feet. It results in the deterioration of the outer protective layer of these nerves, causing them to short-circuit, akin to electrical wires. The introduction of a daily supplement like benfotiamine can aid in reversing this nerve damage, but we'll delve further into diabetes remedies later in this discussion. This brings us to the fourth sign, an abundance of skin tags. While it's common to have a few skin tags, a noticeable increase in their presence may signal prediabetes or high blood sugar levels. The elevated insulin in your blood weakens your immune system, allowing the reactivation of the HPV virus, which can lead to the formation of new skin tags and, at times, warts. Remarkably, those who successfully reverse insulin resistance often find that their skin tags naturally diminish and eventually disappear. Skin manifestation number 5: to be vigilant about are bed sores or ulcers. These often afflict individuals who consume processed carbohydrates or grapple with insulin resistance or diabetes. These ulcers are essentially open wounds that form on the skin and tend to linger without rapid healing, primarily because elevated insulin levels can inflict damage upon the blood vessels beneath them. It's worth noting that approximately 15 to 25% of diabetes patients will encounter a diabetic foot ulcer at some point during their lifetime. Moving on to sign number 6. We observe the development of hardened skin on the fingers. In cases of insulin resistance, the skin on the knuckles, fingers, and hands may undergo thickening, resulting in a somewhat waxy appearance. Inadequate diabetes management through dietary modifications can lead to stiffening of the hands, accompanied by sensations akin to having small pebbles within your fingertips. This brings us to sign number 7, where the fingers start to exhibit a forward pulling sensation. In conjunction with the aforementioned hardened skin, individuals with diabetes may also experience increased stiffness and restricted mobility in their fingers. This is due to the thickening of the fascia beneath the skin. You might notice the emergence of small lumps or nodules beneath the skin's surface on the palm of your hand, which can initially be tender but tend to subside over time. High insulin levels and insulin resistance are the culprits behind this phenomenon, leading to unusual thickening and growth of the fascia in your hands. Now, sign number 8: to be aware of is shin spots. Elevated blood sugar levels associated with diabetes can weaken blood vessels in the legs, causing seepage of blood byproducts into the skin. Consequently, dark, brown, reddish, circular spots can manifest on the lower legs, particularly around the shins. Typically, these spots vanish within 18 months, but they are relatively common among diabetic patients due to the detrimental effects of high insulin, or glucose, on the blood vessels beneath the skin. Moving forward to sign number 9, we encounter skin bumps. Diabetic and prediabetic individuals often exhibit elevated cholesterol levels in their blood, indicating that the liver is struggling to break down cholesterol effectively. This struggle results in the formation of small, firm raised spots beneath the skin, appearing as clusters and measuring between 1 to 4 millimeters in size. It's important to note that this condition can also be linked to thyroid issues, liver disease, and kidney disease. Therefore, if you notice the emergence of these skin abnormalities, it's advisable to consult your healthcare provider for a thorough evaluation. Lastly, sign number 10 involves puffy eyelids. Glucose, or blood sugar, has an affinity for binding to water. Consequently, individuals with high blood sugar and diabetes may experience puffiness beneath their eyes. While this alone does not necessarily indicate prediabetes, if it accompanies other symptoms discussed in this video, it may suggest an underlying blood sugar issue that could potentially progress into diabetes without dietary corrections. If you identify with one or more of these symptoms, it is strongly recommended that you seek medical attention and request a HOMA-IR test. This simple blood test measures your blood glucose and insulin levels after a period of fasting, providing valuable insights into whether you have insulin resistance, prediabetes, or diabetes. Additionally, Consider having your A1C levels tested to assess your average blood sugar levels over an extended period. If you receive confirmation of an issue, exploring straightforward methods to reverse the condition is advisable. As previously mentioned, diabetes stems from insulin resistance, a condition where your cells fail to effectively absorb sugar from your bloodstream. Over time, the persistent elevation of insulin levels and blood sugar in your body contributes to the development of the skin symptoms we discussed earlier in this video. To effectively reverse diabetes or insulin resistance, it is imperative to restore the proper functioning of your cells, enabling them to efficiently remove excess sugar from your bloodstream and regain control over your blood sugar levels. Here are 6 expert tips to aid in this process. 1. Reduce high glycemic foods. Give your cells and insulin receptors the opportunity to rest by minimizing your consumption of high glycemic foods that rapidly elevate blood sugar levels. Eliminate sugary treats, starchy foods, and refined carbohydrate-based items such as biscuits, chips, candies, bread, pancakes, pasta, ketchup, soda, and similar refined carbohydrates. By reducing your carbohydrate intake, you'll mitigate insulin resistance, allowing your cells time to catch up and stabilize your blood sugar. 2. Incorporate healthy fats. Replace refined carbohydrates with healthy fats derived from sources like avocados, pasture-raised eggs, grass-fed butter, raw coconut oil, and extra virgin olive oil. These fats, along with proteins, can provide sustained energy, promote satiety, and work towards reversing insulin resistance. 3. Harness the power of anti-diabetic herbs and spices. Embrace the benefits of anti-diabetic herbs and spices that have the potential to reverse insulin resistance. Options such as berberine, cinnamon, green tea, bitter melon, turmeric, black seed oil, fish oil, and apple cider vinegar can significantly help regulate your blood sugar levels and enhance insulin sensitivity. 4. Prioritize organic cruciferous vegetables. Make a daily habit of consuming organic cruciferous vegetables such as collard greens, Swiss chard, broccoli, Brussels sprouts, cabbage, and cauliflower. These foods are rich in essential minerals like potassium and magnesium, which enhance cellular sensitivity to insulin. Furthermore, their soluble fiber content and phytonutrients directly contribute to stabilizing blood sugar. 5. Practice intermittent fasting. Break the habit of frequent snacking throughout the day, a major contributor to insulin resistance. Embrace intermittent fasting by restricting your daily calorie intake to a 6-hour window and allowing your body 18 hours of rest and digestion. Fasting is a potent technique to promote cellular openness, reverse insulin resistance, and enhance digestion. It can significantly alleviate many of the skin symptoms discussed in today's video. 6. Prioritize sleep. Recognize the importance of quality and duration of sleep in reversing insulin resistance. Many diabetics struggle to achieve deep, restful sleep, which can lead to elevated cortisol levels, a stress hormone that raises blood sugar. Aim for an extra 1 to 2 hours of sleep each night or take naps during the day whenever possible. Improved sleep patterns can lead to reduced food cravings, hormonal balance, and better blood sugar control. In addition to these dietary and lifestyle changes, consider exploring specific vitamins, minerals, and supplements to complement your efforts in reversing insulin resistance and managing diabetes. Stay tuned for more useful health information. Don't forget to like and subscribe to update the latest videos. Thanks for watching.